Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the cervical spine. And it's one that we probably all learned early on in PT school. So when we got into ortho class and you're sitting in at day one, it's probably one of the first few tests that you learn, and you're probably sitting with it in your pocket right now, about to pull it out the next time you have somebody come in. And that is Spurling's test. So this test came from a paper in 1944 by Dr. Spurling and Dr. Scoville. I don't know why they left Scoville off of there. But they were neurosurgeons, and they wanted a test for a thing called radiculitis, so that radiating symptoms there. Now the interesting thing about this test that I found a systematic review, which I've linked in the comments, that there are quite a few ways to perform it. So there's some variation in the ways to perform it. There's also variations in what is considered a positive. And the author said, this is what's possibly leading to the sensitivity and specificity being all over the place for this test. So the original way that Dr. Spurling and Scoville wanted to have it performed, it was an ipsilateral side bendings or lateral flexion and a compression. So Mateo's a little stiffer, I have to use the other model. So just bending down and boom, boom, there. And if it produced those arm symptoms, they said that's a positive. Now looking at the 7 studies that are included in this systematic review, there's all sorts of variations. I know the way that I was taught how to do it was that you had somebody extend and then you side bend them and then you provide that compression down. And if it produced pain, it produces their symptoms, then that's a positive. So in these other ones, they have them just with the lateral flexion and the compression. They have the extension and the lateral flexion. Some have extension and a rotation. Some have a rotation in it. Some of them have multiple steps to do with them, as well as what is considered a positive. So some of them say if it just produces symptoms. Some of them say you have to have the radiating symptoms in it. So it's kind of all over the place. And so the authors of the second study, that systematic review, said this is why the sensitivity and specificity is just all over the place with it. So that can lead to probably some mixed outcomes. Now, it was said, I did find one thing that said, this is probably best not used in a silo, just not being the only thing that you do. So somebody comes in, it's not the only thing that you do, but you use it as a cluster, that you use it in your screening. But most importantly, you listen to the patient, that you get that good patient's history, and that's what can lead you to a better diagnosis and therefore the better treatment. So there you go. That's a little bit about Spurling's test. So what I'd like you to do, share how you do it. How were you taught? Are there any variations in it? And what do you consider a positive as well? Just share that with us. I think that'd be great to get a discussion and we can talk about this. So, well, and until next time, we'll be here. But until then, take care of yourself. Take care of your patients. We will see you then.